Which one? Maybe I have not seen. You can see the screen.
Yeah. Now
Okay.
no. Now is. Now no. Cannot.
Screen
Now
cannot see. Yes or no?
is sharing, but no content. Don't know why.
No worries. Again, I'm sharing. It is showing now.
No. No.
My camera also not working. Okay, I don't mind.
You don't mind?
No, now at least if I can share you the PDF file.
I cannot see. Not camera, not sharing. Nothing of them.
You can try to. Hello. Hello. Can you hear me?
Yeah. Is
I accepted it in the very beginning when we first. That time I accepted. But
you
it is
leave
taking
me?
time.
Why to leave me at the door?
You can see.
No. Share. I
Okay.
cannot see. You can rejoin. I will remain. I will. I
Okay.
will.
Okay. I will leave. I will leave and I will join again. Okay, right.
And I will not.
Hello.
Mm,
I hope now it will work. I hope. I wish.
yeah. If it is not working, it's okay. I am using laptop. You can start. Not working. Hello?
Hmm.
Not working.
What to do?
We can start.
Okay, then as we are not using now video, we can uh, our communication is, I mean, sound is okay. So rapidly we can read.
Describe what you see.
Mm-hmm, yes. Okay. And there is partly
Okay.
papule, central ulcer, and granulation tissue on the base, inverted edge surrounding telangiectasia,
What is your differential diagnosis?
squamous cell carcinoma, basal cell carcinoma, tuberculosis, actinic keratosis.
Natural history of basal cell carcinoma.
It is indolent with less indolent with slow progression, locally destructive, but limited potential to metastasize.
Yes, examiner gives you histology report. What will you look for? The report.
I will I will look for size and invasion and depth of margin and margin, either it is clear or not.
Yes. If unclear margin, what to do?
Re-excision with the safety margin following frozen section or most micrographic surgery.
If there is lymph node involvement, what to do?
Lymph node biopsy, either FNAC or excisional biopsy.
Okay. What is the frozen section?
It is a laboratory procedure by which rapid microscopic analysis of a specimen can be done.
Advantage of frozen section?
Give rapid intraoperative pathological diagnosis.
Can you explain the steps?
The surgeon take a small
Okay.
piece of tissue and over phone.
Mm-hmm. How do malignant cells reach lymph node? Okay.
Then
Skin graft to patient graft failure subsequently. Possible causes.
infection, graft rejection, and hematoma formation.
Common organism. Okay. What to
Staphylococcus,
do to
Staphylococcus,
diagnose?
or Staphylococcus aureus
Ah,
and
streptococcus.
and Streptococcus. Staphylococcus aureus, Streptococcus. How to swab for culture and sensitivity and blood for WBC and CRP.
What to do if swab for MRSA positive?
Isolate the patient and inform the infection control team and follow infection control protocol. Wound debridement with incision and drainage of the abscess and give antibiotic according to the task protocol and microbiologist advice.
How to decolonize MRSA?
Decolonize MRSA, decolonize MRSA. Okay, nasal meprisone ointment and chlorhexidine body wash.
Yes. Involved in management ward nurse microbiologist infection control. Okay. Read Sternberg. Okay.
Patient developed axillary lymph node lamina biopsy showed a large cell with a bilobe nucleus with a prominent eosinophilic nucleus. Okay, ounce eye appearance means it is red stem bug cell, non-Hodgkin's, it is Hodgkin's. Red,
No.
sorry, red
Mm,
Hodgkin's. Yes, yes. The red stem bug cell, it is
define,
Hodgkin's lymphoma. Okay.
define, define carcinoma.
Carcinoma. It is a type of cancer that develops from the epithelial cell and spread by the lymphatics.
Good, good. Featured of malignant cell.
Increased number of mitosis, abnormal mitosis, hyperchromatism, pleomorphism, and increased nuclear to cytoplasmic ratio. Have you seen the way we modified the answer? It is written like this way.
Mm.
It is good. Okay.
Someone,
So
someone,
has
someone
someone has
stole,
leaked my
stole.
my paper and
Yeah, yeah,
given to them. Maybe that
yeah.
person is Doctor someone who run in sleep and walk in sleep.
Who? Who?
Doctor Esra maybe.
Yeah, I understand, but I am asking who, what, how did you describe him? Walking in the sleep?
Talking, walking.
Hello?
Yes,
Hmm. Okay, next. Them?
78-year-old diabetic woman referred for temporal artery biopsy having shoulder pain and tender scar for 1 week. When performing a temporal artery biopsy, you find nodular lesion with some ulceration in the neck of the patient suggestive of primary skin carcinoma, probably basal cell carcinoma.
Why is temporal artery being biopsy?
To detect giant cell arteritis,
Medical treatment for this condition?
a large dose of corticosteroid.
Doses?
Orally 60 milligram prednisolone daily, or if the patient present with some complication like emesis progressus and loss of vision, then we can start 80 milligram methyl prednisolone IV, and we will continue the treatment for 2 years.
Very good. Why is steroid therapy often started before biopsy is taken?
Uh,
E-
oh,
Easy.
oh,
Mm, easy. For fear of what?
asthma has this file.
Smell?
Yes,
How did you know?
yes, I am 100% sure she has this file.
How did you know?
Because yesterday, while studying, when I was reading these questions, she was answering exactly like this. When I was answering that way, she was telling, no, you have to answer it like this. And the picture she
Mhm.
sent in our group, two pages. You see, it is exactly the same pages. And she said she took
Where?
it from, yes, these
I
things
didn't
actually
see
make,
this.
these things actually makes upset.
Was the same design?
Same design, same page design. You can see.
Mm,
Anyway.
okay.
Okay. Okay. Large dose of corticosteroid. Why steroid therapy is often started before the biopsy is taken? To protect vision from ophthalmic artery involvement from arteritis. To protect vision from protect vision from ophthalmic artery involvement from arteritis. Okay.
Okay. What features of the tumor may give insight into the risk of metastatic disease?
What four item of data would you want to see in the pathology summary report? Okay, the type of tumor verification, tumor diameter, tumor thickness, and margin clearance, lateral and deep margins. Okay, type of the tumor, tumor diameter, tumor
Then,
thickness, and margin clearance, lateral and depth of the margin. Okay, next.
yes. What features of the tumor may give insight into the risk of metastatic disease?
The presence or absent blood or lymphatic invasion. What
6 months
features
later,
of
the
the
patient
tumor? These two totally new. What features of the tumor may give insight into the risk of metastatic disease? The presence or absence of lymphatic invasion. Okay. Hmm.
Mhm. 6 months later, the patient readmitted following mechanical fall in the community. Radiology revealed a fractured neck femur, okay, requiring surgical intervention. What factor in the scenario can predispose to the osteoporotic fracture?
Long-term use of steroid,
Oh,
postmenopausal women, age and female gender.
yeah, yeah. From the biochemical prescriptive, what do you expect the serum calcium phosphate level to be considering the patient is in osteoporosis?
In osteoporosis, both
Yeah,
will be normal. In osteoporosis, both will be
yeah.
normal.
Volume overall volume in decrease
Volume will decrease,
during
but will be normal in mineralization and
the
overall both. Hmm.
yeah. During surgery, the bone matrix appears to be soft and fragile. The sample sent to the histology revealed plasmacytoma or myeloma. Uh, what will you find in this?
Neuroplastic, monoclonal proliferation of the plasma cell. A sample sent for the histology and the revealed plasmacytoma or myeloma. Plas- Plasmacytoma or myeloma. What we'll say as plasmacytoma, we'll say plasma. Okay. Neuroplastic, monoclonal proliferation. Neuroplastic, monoclonal proliferation of the plasma cell. Neuroplastic monoclonal proliferation. Neuroplastic monoclonal proliferation of the plasma cell. Okay. Next.
Hmm. Okay, what may such tumors commonly secrete into the serum?
What is such tumor commonly secret into the serum? Into the serum, they secrete myeloma, immunoglobulin, fragmentation of the immunoglobulin. In the serum, they secrete myeloma, immunoglobulin, or fragmentation of immunoglobulin
What is Bin's
protein.
you want to tumor treat myeloma, immunoglobulin, or fragmentation of immunoglobulin.
Hmm.
Okay, immunoglobulin or fragmentation of immunoglobulin. What is Bin's protein?
It is a light chain or paraprotein, which may be identified in urine. Okay, Ben Jones protein. It is a light chain protein which may be identified in the urine. Ben Jones protein. Ben Jones protein. It is a light chain protein which may be identified in urine. Okay.
In cases of melanoma, light chain protein can be identified in urine in multiple myeloma. Apart from osteoporosis, what may be the cause of fracture of this patient?
Apart from the cause of okay tumor itself and bone lysis by the tumor itself or bone lysis by the tumor itself or bone lysis by the tumor lysis or bone tumor lysis tumor tumor lysis
Tumor
tumor
itself.
itself tumor itself or bone lysis by
Bone,
tumor. Okay.
the screw is required to repair the fracture. Some radiotherapy is planned. However, the wound side heals poorly with septic breakdown. What are four factors likely to contribute to wound sepsis?
Steroid, diabetic, immunocompromised because of the plasmacytoma and foreign body processes. Steroid therapy, diabetic patient, immunocompression because of plasmacytoma and foreign body processes. Steroid, diabetic, immunocompression and because of plasmacytoma and foreign body processes.
Despite antibiotic treatment, the hip infection persists. Infection, excision of the hip, the fracture repair followed by full hip replacement after the patient arrested 24 hours after surgery. What is the cause of this one?
Venous thromboembolism. Venous thromboembolism of
Arrest
the fracture repair followed by full hip replacement. Followed by full hip replacement, there could be DVT. DVT. Okay.
you he means pulmonary embolism or DVT. Why to arrested?
What is the despite antibiotic treatment, the hip infection persists. Infection excision of the hip and the fracture site repair followed by a full hip replacement after the patient arrested. Okay, okay. Arrested now. Arrested 24 hours after the surgery. Okay, this is arrested means cardiac arrest. This is coronary.
May
This
fat embolism.
could be Would be venous thromboembolism. What is the cause of this? It is venous thromboembolism. So yes, answer is venous thromboembolism. It is safe. Cardiac MI also can happen, or fat embolism also can happen. Fat usually happens
Mm,
long bone traumatic. Traumatic. Okay.
trau-
It is
traumatic
venous thromboembolism. Venous thromboembolism is safe answer.
is
Then,
right.
hmm.
This answer is right.
Yes. This answer is
What's
right.
what's pathology of osteoporosis? Normal bone mineralization with decreased bone. Oh,
Hmm.
read read this question. What's pathology of osteoporosis?
Okay. Next one.
Hmm?
Where you're reading? Next, station 2.
Next,
That one?
in next. Ah, sorry. Yes,
Okay.
I
Station 2.
I.
Station 2 is,
Mm.
no problem. Station 2. Giant cell arteritis, maybe 76-year-old female referred for temporal artery biopsy, presented with headache, scalp tenderness, upper limb stiffness, and transient loss of vision in one eye.
Why biopsy taken?
To identify giant cell arteritis.
What's this? The previous was giant cell arteritis.
Some
This
question was
okay.
missed actually.
What is giant cell arteritis?
It is a granulomatous inflammatory disease that affect the large vessel of the head, mainly the branches of the external carotid artery.
Pathology of giant cell arteritis.
Pathological giant cell
In
arteritis. It is a granulomatous inflammation. There is infiltrate of T cell and macrophages and multinucleated giant cell. It is a granulomatous inflammation with fragmentation of the internal elasticity. And infiltrate 3 was
yes,
there, right?
yes. The next question. What are the
Fragmentation.
histological findings?
Mm-hmm. Oh, this is
He
pathology.
he.
One is pathology, another one is
mm,
histology. Pathology is granulomatous inflammation, and there is infiltrate of T cell and macrophages and multinucleated giant cell. What is the histological finding in the biopsy? Intimal thickening within the internal elastic lamina fragmentation and infiltration of the T cell, macrophages, and multinucleated giant cell. Next.
mm, what's the cause of loss of vision?
Because of the involvement of the ophthalmic artery, which gives the central retinal artery, which is an end artery.
Simple blood test.
ESR and CRP.
Patient came back a year later with fractured neck of femur.
How
Okay.
how it is
What
treated? Mm, mm.
you did,
Okay.
and the next you did. What likely pathological process would have disposed for the
Oste
osteoporosis or
Osteoporosis
avascular?
or avascular necrosis.
What other risk factors?
In elderly, Paget's disease, osteomalacia, hyperparathyroidism, neoplasm, primary or metastatic.
Good. What's pathology of osteoporosis? This question.
Normal bone mineralization and decreased bone density.
Is that decrease in bone density?
Normal bone mineralization. Overall decreased bone volume. That volume
Yeah.
is the density same. It is okay.
Index scan. There will be affection or not? in osteoporosis.
Well, which one you are
Mechanism
asking?
of hmm?
Mechanism of
Mechanism
osteoporosis.
of
Okay.
mm.
Reduce bone mass due to excessive bone resorption and inadequate new bone formation. Reduce bone osteoporosis. Okay, osteoporosis reduce bone mass because of excessive bone resorption and inadequate new bone formation. Hmm.
What are the perioperative concern?
Steroid coverage need to give to avoid relapse of the arteritis and to avoid additional crisis and electrolyte disturbance.
Is after orthopedic surgery, she developed confusion, shortness of breath, petechial rash. Possible diagnosis:
This is fat embolism.
pathogenesis of fat embolism.
Mechanical theory, fatty tissue is directly released into the vascular circulation as a result of trauma, and by chemical theory, inflammatory response to systemic circulation from the bone marrow.
Mm.
I will say the
Osteoid
first one, mechanical theory. What I read there.
Yes,
Okay.
and we can add that it
Arrest,
causes the same.
arrest in the
As,
microcirculation.
yeah. What is osteoid?
Osteoid is a protein mixture secreted by the osteoblast that form the organic matrix of the bone.
Organic bone matrix secreted by osteoblast forms organic matrix of the bone. Risk factors for osteomalacia.
Vitamin D deficiency, malabsorption, renal failure, state therapy, short bowel syndrome,
Yes, type of
spondylitis,
protein deposit.
amyloid AA. Arrangement of the protein is in fibrils which is not easily degraded by the protein enzyme and cannot be. Okay. Yes, sir. Blood sample is taken
Amyloid.
in standardized tube. Then measure how long it takes a red blood cell to shrink in the bottom and get modified version in the now. Now, our answer is better. Okay,
Mm-hmm.
next station three. Young patient with a background of hyperthyroidism has what?
Yes, continue.
Yes, young patient with a background of hyperthyroidism has now developed secondary renal failure. He also has renal stone, blood results available. Hmm.
How is hyperparathyroidism caused in renal failure?
Abnormality in the renal tubular absorption of the phosphate causes hyperphosphatemia, and decreased production of 125 dihydroxy vitamin D causes hypocalcemia. So hyperphosphatemia and hypocalcemia induce PTH secretion, and it is a secondary hyperparathyroidism.
Lining epithelium of urinary tract.
Stratified transitional epithelium or urothelium.
Types of stone.
Calcium oxalate, calcium phosphate, struvate, cystine, urate. sorry Calcium
Yes,
oxalate,
what
calcium phosphate, struvate, uric acid, struvate, I said urate, it should be
you
uric acid, struvate, uric acid, and cystine.
okay? What are the genitourinary complications of stone?
Obstruction, infection cause pyelonephritis, renal cell carcinoma, fistula formation, deterioration of the renal function, and rupture.
Management of stone. Healing.
Keep stone size according to the size and location in the urinary tract, and stone size less than 5 millimeter. uh, Stone size less than 5 millimeter, watchful waiting by analgesia, alpha blocker, and hydration, proper hydration, and stone less than 10 millimeter, extracorporeal shock wave lithotripsy. Stone size 10 to 20 millimeter, consider ureteroscopy and shock wave lithotripsy. Stone size more than 20 centimeter, including any staghorn stone, percutaneous percutaneous nephrolithotomy, and stone size of any size obstruction, urgent percutaneous nephrostomy, urgent decompression by ureteroscopy or nephrostomy. Okay, this answer is shortcut. Okay,
Hmm?
this answer is shortcut. You
Risk
can
factor.
remember, no problem. Mhm. Risk factor of the renal cell carcinoma: smoking, hypertension, obesity, stone, uh, mm, then industrial dye exposure, and chronic kidney disease.
Mhm. How can stone cause cancer?
Stone causes chronic infection and inflammation, so metaplasia to dysplasia to DNA damage and cancer.
Most common renal cell carcinoma.
Clear cell carcinoma,
Second or
papillary cell carcinoma,
most common in renal dialysis patient.
papillary cell carcinoma,
Compare between macroscopic finding in clear cell and papillary carcinoma.
macroscopic. Okay, macroscopic clear cell carcinoma arises from the proximal convoluted tubules. It is unilateral or solitary. It has bright yellow-gray mass, and margins are sharply defined and confined within the renal capsule. And a prominent area of cystic softening or of hemorrhage. This one, I don't know. Okay, and papillary carcinoma arises from the distal convoluted tubule. It is bilateral and multiple, less orange yellow in color because of their less lipid content, and papilla formation with the fibrovascular course, and there is necrosis, hemorrhage, and cystic degeneration.
Mm. What is microscopic finding in both?
In clear cell there will be rounded or polygonal shaped clear or granular cytoplasm which contains glycogen and lipid, and papillary cell carcinoma cuboidal or low columnar cell with papillary formation and in the with samoma bodies, and stroma is usually empty.
R1 means
R1 means microscopic residual tumor.
good stem.
Testicular cancer, 32-year-old male patient with a 1 month history of right groin lump, firm non-tender lump, testicle not palpable in the scrotum. Ultrasound showed 6 centimeter partially cystic solitary mass and internal ring infiltrate the local soft tissue and extending into the abdomen. No other pathology seen.
Differential diagnosis.
Undescended testis, testicular tumor, soft tissue tumor, inguinal lymphadenopathy, inguinal hernia, femoral artery pseudoaneurysm.
Yeah. Orchidectomy and wound biopsy from the Sylvester's region done. Pathology. Testicular teratoma was involved with margin, local tissue, lymphatic, skeletal invasion. Discuss the pathology report with the family in simple lines.
Okay, this is the tumor of the testis, and unfortunately, this tumor has not been resected completely. The patient may need another surgery and chemotherapy, and spreading to local and reaching bony and lymphatic glands. Spreading to locally and reaching to bony and lymphatic glands.
Where does teratoma initially spread?
Aortic lymph node.
Testicular tumors according to age group types.
Testicular tumor, according to okay. In young age, there will be yolk tumor and embryonic carcinoma. Age 20 to 30, there will be teratoma. Then 30 to 40 will be seminoma, and age more than 60 will be lymphoma.
And teratoma?
Teratoma, I said
Mm,
teratoma 20 to 30.
20 to 30 seminoma, from 30 to 40, after
Hmm.
50 lymphoma, right?
Hmm. Hmm.
Vascular
And
carcinoma,
an early age yolk sac tumor and embryonic carcinoma.
and embryonic carcinoma. Oh. What's carcinoma?
It is a malignant teratomatous neoplasm with a placenta-like differentiation.
Immunohistochemical marker to confirm.
Beta is CD.
Other type of malignancy at this age.
Seminoma.
What's alpha fetoprotein?
It is a alpha fetoprotein. It is a protein normally produced by the yolk sac in the fetus. It is a protein normally produced by the yolk sac in fetus life. It may indicate yolk sac differentiation teratoma.
Mention another non-germ tumor cell with high alpha fetoprotein. Non-germ tumor.
Hepatocellular carcinoma.
Yeah, yeah. Okay. What is the value of lactate dehydrogenase in testicular teratoma, testicular cancer?
It reflects the tumor load and rate and growth of the tumor. It reflects the tumor load and rate and growth of the tumor. Therefore, it helps in evaluation of the tumor.
Post-operatively developed hematoma. What are the stages of hematoma resolution?
In 1 week, there will be lysis of hematoma. Okay, lysis of clot by macrophage in 1 week, and growth of fibroblast into the hematoma in 2 weeks.
Mhm. Lysis and fibroblast growth in the hematoma. After a few months, he developed small pneumothorax called
Lung metastasis.
define metastasis.
Survival and growth of a cell at a site distant from the primary origin.
Beta HCG normally released in men. From where?
Seminal plasma.
Stem.
69-year-old male presented with 1 month history of bilateral groin lump. On examination, found non-tender lump with gray scales. Doctor ultrasound finding include diffuse testicular infiltration, enlargement with hypervascularity of Doctor ultrasound findings include diffuse testicular infiltration, enlargement with hypervascularity, or multifocal areas of hypoequic solid and hypervascular nodules within testes. Orchidectomy was done, and testicle was found to be white, tan, pink, and fleshy. Pathology report
Histology
said
report.
the neoplastic cells typically express CD20.
Yes. What's your diagnosis?
It is lymphoma.
Classification of testicular tumors and give example.
Okay, it can be a germ cell tumor, non-germ cell tumor. Germ cell tumor, seminoma, non-seminoma. Seminoma, we have classic, spermatocytic, and anaplastic. And non-seminoma, we have teratoma, yolk sac tumor, and choriocarcinoma. And non-germ cell tumor, we have Sertoli cell, six-cord stromal tumor like Leydig cell tumor and Sertoli cell. And then we have other like metastatic tumor and lymphoma.
Germ cell, non-germ cell. Germ cell, seminoma, classic, spermatocytic, anaplastic, non-seminoma, teratoma, yolk sac, choriocarcinoma, embryonic carcinogenic. Okay. The six cold stromal lytic cell tumor, Sertoli cell, other metastases, and lymphoma. Describe microscopic morphology of testicular teratoma versus seminoma.
In seminoma, there will be sheet-like cord of cells separated by fibrous septa. Sheet-like cord of cells separated by fibrous septa, large prominent nucleoli. And teratoma, composed of variant size of the cells or the organs, components, composed of
Various
various size of the cells of organs components.
seminoma, a sheet-like cord of malignant cells separated by fibrous septa, contains lymphocytes, and cells are large with prominent nucleoli. He presented with pulmonary embolism a year later. Is found to have a large mass at the region of para-aortic lymph node, compressing renal vessels, debarking surgery done, but tumor cannot be totally resected. Frozen section showed thyroid tissue. Why? What is called?
It is called stroma ovale. It is called stroma ovale and thyroid tissue because teratoma may contain all three germ layer like ectoderm, mesoderm, and endoderm, and which can differentiate into thyroid tissue. So teratoma, that is why it is like this, and it is called stroma ovale.
What is stroma ovarii? Stroma?
It is stroma
Stroma
ovale.
means
Stroma
what?
ovale. It is called this situation.
After metastasis, called stroma ovary? 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 After metastasis or when? Which situation?
Not metastasis. It is suppose uh, thyroid tissue. Thyroid tissue was found in the testis.
Okay.
Why?
When
Because
we
it it
found,
it was a testicular teratoma. Okay,
mm, okay. Explain finding in adenocarcinoma.
adenocarcinoma. There will
Sleep,
be
sleeping, sleeping. I can see. Sleep. Yes, I can see.
not sleeping.
Sleeping. I can see. Explain. No, not to sleep because just now I have idea. Inshallah, be ready for sim- simulation or like exam station. I will choose in 3 hours. You will do all station. Will choose one of them, and you will take your yeah. Be ready. What's the composition of pulmonary embolism? Pulmonary embolism
Okay,
or thrombus?
No, in pulmonary
Okay.
embolism mainly consists of the thrombus. It will have platelets and polymerized fibrin and the circulatory blood flow product. And finding in adenocarcinoma, failure of the differentiation and subsequent malignant transformation of epithelial differentiation line. Failure of the differentiation and subsequent malignant transformation of epithelial differentiation. Okay, platelet, polymerized fibrin, and admixture of circulatory cells. Hmm.
Okay. Closing factor allowing polymerization of fibrin,
It is activated factor 8.
sibling coagulation cascade, intrinsic and extrinsic.
Intrinsic pathway, it is triggered by damage to the blood vessel and for example, platelet plaque rupture, okay, and initiated exposure to the negatively charged surface such as collagen, activated factors or humanist factor, and no, I will say as like what we studied there. Intrinsic pathway, it is triggered by the damaged blood vessel and activation of the clotting factor 12, which will activate 11. 11 will activate 9, and 9 will activate 8, and 8 will activate factor 10. And extensive pathway triggered by the external trauma causing tissue injury, and which will release tissue factor, and they will cause activation of the factor 7, and factor 7 will activate factor 10, and then they will initiate common pathway. Activated factor 10 join the common pathway. Activated factor 10, okay, need to read this. Convergence, both the intrinsic and extrinsic pathway converge at the activation of the factor 10. Thrombin formation, factor 10, along with the factor 5, calcium and phospholipase activates prothrombin to thrombin, and thrombin convert fibrinogen to fibrin, which forms mesh-like structure that tapes platelet the blood cells forming the blood clot. Okay. Now, on pathway we know. We will say it from our that answer. What is the causes
Yes.
of pulmonary,
What is the
pulmonary
in this
embolism in
patient?
circulation? Because of venous stasis, and hypercoagulable stasis because of the tumor.
Where could the beta HCG found in normal male
Seminal plasma.
would stem?
34-year-old male underwent with asthma and hypertension. Asthma and hypertension. Asthma and hypertension, referred with the backache. CT of the abdomen showed bilaterally enlarged kidney of 25 centimeter.
There is two questions before. Why this is unlikely to be cellular rejection process or not? I don't know where the
Oh, where? Which
uh,
question?
next next.
Next,
Yes, okay. On in the light of the picture given, what's the diagnosis?
it is polycystic kidney disease. Okay, enlarged kidney
Hmm?
diffusely enlarged with multiple cystic variable size, adult polycystic kidney disease. Enlarged kidney, diffusely enlarged, okay, enlarged kidney with multiple cysts, okay, it we should say enlarged kidney with multiple variable size of cyst, and adult polycystic kidney disease.
Other organs?
In the liver,
Cyst?
pancreas, and the spleen.
Mm, okay. Ovary? Other pathology associated with polycystic kidney disease?
Other
Other
pathology associated with subarachnoid hemorrhage, berry aneurysm associated with risk of subarachnoid hemorrhages. Berry aneurysm associated with subarachnoid hemorrhage.
we have another answer.
No,
This
no,
pathology
this one, same.
that
Berry aneurysm.
that's
Berry
enough.
aneurysm.
We
Hmm.
have
Hmm.
another, not only this. Adult
Yeah.
polycystic kidney disease is normally associated with deterioration in creatinine and urea level. Can you explain why this occurs in terms of the kidney tissue? Why there
The
is
The cystic changes in the kidney tubules will lead to loss of functions and the obstruction of the other renal tubules. There is associated fibrosis and some granular loss. All of this will deteriorate the renal function causing renal failure. This
List
answer
three
is
complications.
hmm,
Hmm.
okay. Okay. Three complication of hemorrhage, renal cell carcinoma, and infection.
Following bilateral nephrectomy, the patient maintained by hemodialysis. Raised transfusion. Okay. What determine if a potential kidney donor is suitable؟
Ebio
هنعمل
blood,
ايه يعني؟
ebio
امم
blood grouping and HALA antigen
لا. Human
or asthma
leukocytic antigen.
antigen.
Can a non-perfectly matched kidney non-perfectly matched kidney be
Yes,
transplanted?
yes,
Yes. You want
yes. With it.
to say yes with enhanced protection and maintained of
Yes,
immunity. After transplant, the patient developed fever, tenderness, declining renal function. What's your pathology?
Either infection,
Tenderness, fever.
infection or rejection.
Mm. What are the two types of rejection? Generally recognized from the data on immunity basis.
Cellular rejection, hormonal antibody rejection. This is new question. Cellular rejection and hormonal. Cellular rejection and hormonal antibody rejection. Cellular rejection, hormonal antibody rejection. Okay.
Humoral antibody. Humoral
Humoral.
antibody
Cellular
rejection.
rejection and humoral antibody rejection.
Good. His rejection was treated and maintained on immunotherapy. After 6 years, general malaise is developed. Renal cell shows diffuse infiltration of kidney parenchyma with the high-grade lymphocyte cells with B cell CD20 with scattered mitosis. What does this suggest?
It is lymphoma.
CD20.
CD20 means
Ah,
lymphoma. CD20 is lymphoma and post-transplant lymphoproliferative disorder. PL, okay, post on PTLD, PTLD, post-transplant lymphoproliferative disorder. Next question will be why it
post-transplant
is post lymphoma and
lympho.
post-transplant lymphoproliferative disorder.
Good. Why is this unlikely to be cellular rejection?
Because
Not,
presence of
not.
why this is unlikely to be cellular rejection. The histology sounds to be lymphoma because of the B cell. Cellular rejection will typically show infiltration of the T cell CD3. Why it is unlikely to be cellular
يعني
rejection? In cellular rejection, there will be a T cell infiltration of the T cell CD3, and the histologist should be lymphoma.
what is likely derived of post transplant lymphoproliferative disease? What is the likely drive to this?
Genome matter
Epstein-Barr virus.
expression, Epstein-Barr virus genome matter expression in the context of immunosuppression. What is the likely driver of polycystic post-transplant lymphoproliferative disease? Epstein-Barr virus genome matter expression in the context of immunosuppression. Hmm.
Mhm. Eh,
34-year-old.
we can,
Hmm?
mm,
We can what?
we can. The last question is Epstein-Barr virus the same and cytomegalovirus more than 6 months less than, or this
Hmm.
is another question.
This is the same answer.
Another.
Same answer. Yeah, same answer.
Okay, STEM 2.
Why it is two? It is two. EWO two.
Same two,
TWO is 2.
two,
It is not 2. 2 is THU, 2. And TWO,
two,
it is 2. 2, sharp. Sharp 2.
two.
Okay.
This team is
Same 2.
3.
No, no, 2. 34-year-old man with a previous history of asthma and hypertension referred with back pain. He underwent CTPA, which shows bilateral enlarged kidney measuring about the same stem previous one. 25-year-old male underwent bilateral nephrectomy.
On the left of the picture given, what's the diagnosis?
It is a polycystic kidney disease.
Adult. Adult. What's the mode of inheritance of polycystic kidney disease?
It is autosomal dominant with a mutation
Beautiful.
in polycystic kidney disease 1 and 2.
What other organs could be affected?
By polycystic kidney disease in the liver, ovary, pancreas, spleen, and intestine.
Other pathology associated with this answer
Polycystic
I
kidney
want.
disease
Yes.
is the brain aneurysm, mitral valve prolapse, liver cyst, pancreatic cyst. You were expecting this one.
Yeah. Mitral valve prolapse, liver cyst, pancreatic cyst. What complication of pathology is not seen in this picture? Pain.
Pain,
Pain is
yes,
not
pain.
seen.
First, pain. Pain is not seen.
Okay.
Pain, infection, hypertension, and
Five
renal failure.
and three.
Pain, infection,
What
hypertension, renal
complication?
failure. Mhm.
What complications of pathology can lead to pain?
Infection and hemorrhage. Then, weight of the organ dragging upon its pedicle or stretching of the renal capsule by the tip.
Food, infection, and hemorrhage. What are causes of renal failure in polycystic kidney disease?
Replacement of the normal kidney tissue by cyst with infection leading to scarring.
Leading to scarring.
Leading to scarring.
You, you preferred this the answer or the previous station?
Of course, this one.
Of course. Okay. What's the type of fluid contained within the system?
Transepithelial secretion. Transepithelial
Yeah,
secretion.
transepithelial. What are pathological types of transplant rejection? Acute, hyperacute, accelerated acute, chronic.
Yes.
What are types of matching required before transplant? هلا A, هلا B,
ABO
doctor.
and Hala doctor.
Okay. Can a non-perfect? Yes.
Yes.
How to prevent transplant?
Immunocompression by use of
Immune,
immunosuppression. Immunosuppression.
you said immunocompression. 7 days after transplant, patient developed swelling at the operative site with
Infection
declining renal
rejection.
function. Yes. Rejection. 4 months later, he came with CBD stone, fever, sepsis, diagnosis,
Ascending cholangitis.
management. This is according to care of critically ill surgical
Up.
patient. Yalla. and we and, and
No.
we and we will ERCV to release of obstruction. Uh,
Copy.
ERCV done,
Copy. Copy.
but ERCV done, but he developed sepsis, possible causes, bacterial infection because of this question you didn't answer before. Eh, the
Okay.
the the previous one.
ESP done, but he
ERCP.
developed sepsis. What are the possible causes of bacterial infection in this patient because of the obstruction? Because of the obstruction.
ERCP done. If the patient developed fever, jaundice, and sepsis, what is diagnosis?
Ascending cholangitis,
Risk factor for ascending cholangitis.
stone in the CBD, iatrogenic injury, uh, immunosuppression, and taking steroids.
What's the cause of CBD stone in this patient?
Secondary hyperparathyroidism. Secondary hyperparathyroidism.
Okay, cholecystectomy done, gallbladder sent for histopathological examination. What to look for?
Microscopic for any ulceration or gangrene, and microscopic for any malignant cell or inflammatory cell. Macroscopic ulceration and gangrene, and microscopic for any malignant cell or inflammatory cell.
Mm, okay, okay. Patient come 6 years after transplant on immunosuppression with declined renal function. Biopsy showed lymphocytic infiltration with blast cell. What's the diagnosis?
With blast cell, it is lymphoproliferative disease
Why is not rejection?
because in rejection there will be a CD3 cell.
I like the question that has B and T cell. I like it. How to treat post-transplant lymphoproliferative disorder? Decrease the dose or change the type, right?
Wait. Why it is not rejection? The presence of blast cell. Okay. I thought the previous question you asked from your own. Okay. Okay. The presence of blast cell with characteristics of lymphoproliferative disease. Okay.
You answered.
And this one, how to treat post-transplant lymphoproliferative disorder. How to treat, how to treat post-transplant lymphoproliferative disorder. Decrease, okay, this is a good answer. Decrease immunosuppressive therapy dose or change the type of immunosuppressive therapy. Decrease immunosuppressive dose or change the type of immunosuppressive being used.
Yes. What are positive factors for post-transplant lymphoproliferative disorder? Opportunistic viral infection, cytomegalovirus, and Epstein-Barr virus due to immunosuppression, and C before E. So cytomegalovirus in the first 6 months, and if there is more, EBV.
Coffee.
This is stem.
Okay. Diverticulitis.
Yeah,
Okay. 56-year-old left ileocephane, perforated diverticulitis. Hartmann's procedure was done. Low BP tachycardia and pyrexia.
what's your diagnosis?
It is septic shock,
Define septic shock.
sepsis along with refractory hypertension not responding to fluid resuscitation and needs vasopressor.
Define sepsis.
Systemic inflammatory response along with infection. Quick SOPA
Definition of septic shock.
criteria. Mm-hmm. Ident- uh, Identifies high risk patient for in-hospital mortality with suspected infection outside the ICU. Okay, so It includes the definition of food safety,
Mm-hmm.
how they gave, identifies high-risk patients for in-hospital mortality with suspected infection outside the ICU. It includes
One
one
second.
point for, okay.